Your doctor has been lying to you, not intentionally, not maliciously, but the advice most people over 60 receive about circulation: walk more, move more, get up from your chair, misses the most dangerous moment entirely. The moment you are already sitting. Right now, as you watch this video, blood is pooling in your lower legs. Your venous valves are working against gravity with less muscle support than they had a decade ago. And if you are over 60 and you sit for more than 4 hours a day, your risk of developing a deep vein thrombosis, a blood clot that can travel to your lungs and kill you, increases by 70%. That number comes from a 2018 study published in the British Journal of Hematology, and it does not care how many steps you got yesterday. It does not care that you went for a walk this morning, because the walk happened then and the danger is happening now. Here is what nobody tells you. The problem with poor circulation in older adults is not that you are sedentary. It is that your blood has to fight harder to come back up from your feet. The heart pumps blood down through arteries with pressure. That part works beautifully. The heart is a remarkable engine, and it continues doing its job with impressive reliability, even into advanced age. Veins, the vessels bringing blood back up from your feet to your heart, rely heavily on a mechanism called the skeletal muscle pump. When your calf muscles contract, they squeeze the deep veins running through them and push blood upward. One-way valves inside those veins prevent it from falling back down between contractions. This is your body's second heart. Most people have never heard of it. Almost no doctor explains it at a routine appointment. And after 60, three things happen simultaneously that begin to dismantle this system in ways that compound on each other daily. First, muscle mass in the calves drops by roughly 15% per decade after the age of 50. This is called sarcopenia, and it is not optional. It happens to everyone who does not specifically and consistently counteract it. Less muscle means less compressive force on your veins with each contraction. Second, venous valve efficiency decreases as the valves stiffen and lose their elasticity. The valves that were snapping shut precisely to prevent backflow now close more slowly, allow more reflux, and require more pumping cycles to move the same volume of blood. Third, blood viscosity, its thickness, increases slightly with age due to changes in red blood cell deformability and plasma protein concentration. You are working with weaker pumps, weaker valves, and thicker fluid. The result is not just discomfort. It is oxygen deprivation to your peripheral tissues, chronic low-grade swelling, numbness, the development of varicose veins, skin changes on the lower legs, and in the worst cases, clot formation that can become life-threatening within hours. The exercise I am going to teach you today targets all three of those failure points simultaneously. You do not need to stand up. You do not need a gym. You do not need equipment of any kind. You need a chair, 7 minutes, and the commitment to do this every single day for 7 days. I have been studying vascular physiology and working with older adults for over a decade, and I have seen people reverse measurable circulation deficits in under 2 weeks using exactly what I am about to describe. Stay with me, because in about 15 minutes I am going to tell you about a breathing modification that most physical therapists never mention, and it doubles the effectiveness of this entire protocol without adding a single extra minute to your session. Let us get precise about what poor circulation actually feels like, because I want you to take inventory of your own body. Right now as you watch this, cold feet even in warm rooms, not occasionally but consistently. Ankles that are noticeably more swollen at 7 in the evening than they were at 7 in the morning. Feet that tingle or go completely numb when you sit for more than 30 minutes. Skin on your lower legs that looks shiny, feels tight, or has changed color, darker reddish-brown patches that were not there 5 years ago. Wounds or scrapes on your feet or ankles that take an unusually long time to heal. Leg cramps that wake you at night. These are not minor inconveniences you simply accept as part of getting older. These are your body communicating, in the clearest language it has, that oxygen delivery to your extremities is failing, that the tissues in your legs are running on reduced supply, and tissue that does not receive adequate oxygen undergoes a process called ischemic stress. Cells shift from aerobic to anaerobic metabolism, produce lactic acid as a byproduct, and begin to degrade structurally over time. Chronic peripheral ischemia, left unaddressed, contributes directly to peripheral artery disease, peripheral neuropathy, chronic venous insufficiency, and in patients with diabetes, dramatically elevated amputation risk. The statistics on that last point are staggering. Lower limb amputations in diabetic patients with poor peripheral circulation number over 150,000 annually in the United States alone. But here is what is remarkable about the human body, what makes vascular biology one of the most hopeful fields in medicine. The venous and arterial systems respond to mechanical stimulation with extraordinary speed. A 2019 study from the University of Missouri showed that sitting still for 3 hours significantly impaired arterial function in the legs, measurable via Doppler ultrasound. But a simple periodic ankle movement protocol fully reversed that impairment within the same session. 3 hours of measurable vascular damage reversed in minutes. The tissue had not died. The system had simply gone dormant. And dormant systems, when given the right signal, wake up. That is exactly what this protocol does. It gives your vascular system the precise mechanical signal it has been waiting for. The exercise is called seated calf pumping with dorsiflexion cycling, and it has 3 distinct phases. Each phase targets a different component of the circulatory failure I just described. I will walk you through each one in complete detail. Explain exactly what is happening inside your blood vessels during each movement, tell you the tempo and the repetitions, and then bring all 3 phases together into a complete session before giving you the full 7-day progression. Do not skip ahead. The order matters, the tempo matters, and the breathing modification I am going to explain matters more than either of those things. Phase 1 is heel raises. You are seated upright in a chair, not slumped, not reclined, but with your spine reasonably erect and your feet flat on the floor, hip-width apart. Your hands rest on your thighs or on the armrests. You lift both heels off the floor simultaneously while keeping the balls of your feet and your toes pressed firmly into the ground. You lift until your calves are fully contracted. You should feel significant tension in both calf muscles. And you hold that position for a full 2 seconds. Then you lower slowly, deliberately over a count of 3 full seconds until your heels return to the floor. Then repeat. This is not a casual foot bounce. This is not the nervous tapping people do under conference tables. The contraction must be deliberate, maximal within your comfortable range, and sustained for the full 2 seconds at the top. Here is why that matters at a physiological level. When you raise your heel and your gastrocnemius and soleus fully contract, they compress the deep veins of the calf, primarily the posterior tibial veins and the perineal veins, with a pressure of roughly 100 to 200 millimeters of mercury, depending on the force of your contraction. That is enough pressure to push a column of blood upward against gravity by 6 feet or more. The blood moves up through the popliteal vein behind your knee, into the femoral vein in your thigh, and toward the inferior vena cava, and ultimately your heart. The venous valves snap shut behind it, preventing any backflow. And then as you lower your heel slowly, this is the part most people rush. The gradual release of muscular compression creates a slight negative pressure in the venous system, which draws fresh oxygenated blood in from the arterial side. You are creating a pulse, a rhythm. You are being the second heart for your lower legs, doing mechanically what reduced muscle mass and stiffened valves can no longer do efficiently on their own. 20 repetitions, 2-second hold at the top, 3-second lowering phase. Phase 2 is dorsiflexion pulls. From the same seated position, you now perform the inverse movement. Keep your heels planted on the floor and lift the front of your foot, your toes and the ball of your foot as high as you can toward your shin. Dorsiflex as far as your range of motion allows. Hold for 2 seconds at the top of that position, then lower for 3 seconds. The muscle you are contracting here is your tibialis anterior, running along the front of your shin, alongside the extensor digitorum longus. Most people over 60 have never consciously engaged these muscles in a deliberate therapeutic context, but they matter enormously to the circulatory picture of the lower leg because they pump a different and complementary set of vessels, specifically the anterior tibial veins, which run alongside the tibialis anterior through the anterior compartment of the lower leg. When you alternate between phase 1 and phase 2, even separating them into distinct sets, you create a compression sequence that addresses the entire lower leg from every angle. Phase 1 squeezes from the posterior compartment. Phase 2 squeezes from the anterior compartment. Together they work like two hands alternately wringing a wet cloth from opposite sides. Nothing in the lower leg is left still. Nothing pools. The entire venous architecture of the lower leg is being actively worked and emptied with each repetition. 20 repetitions of dorsiflexion pulls, same tempo, same intentionality. Phase 3 is ankle circles. Lift one foot just slightly off the floor. An inch or two is sufficient, and rotate your ankle in the largest, most complete circle you are capable of. Slow, deliberate circles that move your foot through its full range of motion in every plane. 10 circles clockwise, 10 circles counterclockwise. Then lower that foot and repeat with the other. Ankle circles accomplish something that the previous two phases do not. They mobilize the ankle joint itself and the surrounding soft tissue through a full range of motion, which engages a system that runs parallel to but separately from the blood circulation, the lymphatic system. Your lymphatic vessels carry lymph fluid, which is the clear fluid that surrounds every cell in your body. It carries away metabolic waste products, inflammatory markers, excess proteins, and cellular debris from the tissues, then filters it through lymph nodes and eventually returns it to the bloodstream near your collarbones. The lymphatic system has no pump of its own, no heart equivalent. It relies entirely on two things to move fluid: gravity and the mechanical pressure created by surrounding muscle contractions and joint movement. In people over 60 with reduced mobility, lymphatic stagnation in the lower legs is almost universal. It manifests as the soft, puffy, doughy swelling of the ankle and lower shin that looks as though the skin has been stuffed. That is not water weight. That is lymphatic fluid that has nowhere to go because the joints and muscles that would normally move it are too still for too long. Ankle circles create the mechanical agitation that drives lymph upward. 20 circles each direction, each foot. Now, the breathing modification. I promised you this, and here it is. What I am about to describe is called diaphragmatic breathing synchronized with muscular effort, and it exploits a physiological mechanism called the respiratory pump, a second and completely separate circulatory assist mechanism that most people over 60 have never been told exists. Your thoracic cavity, the enclosed space inside your ribcage, changes pressure with every breath you take. When you inhale, your diaphragm descends, your lungs expand, and the pressure inside your thoracic cavity becomes slightly negative relative to the pressure outside it. In the rest of your body, that negative thoracic pressure acts on the large venous structures that pass through your chest, specifically the superior and inferior vena cava, the great veins that drain blood from the upper and lower body into the right side of your heart. When thoracic pressure drops during inhalation, these great veins expand slightly, and blood rushes into them from below, drawn by the pressure differential. This is exactly what a pump does. And a deep, full diaphragmatic inhale, one that drops the diaphragm maximally and creates the greatest possible pressure differential, is a dramatically more powerful venous assist than the shallow chest breathing that most sedentary adults default to. Studies in the journal Circulation have quantified this effect. Deep diaphragmatic breathing increases venous return during physical activity by up to 30% compared to shallow thoracic breathing. Performing the same movement, 30% more blood returning to the heart, 30% more cardiac output to your tissues on the next beat, for free, just from where in your chest you choose to breathe. So the synchronization works like this. On every heel raise, the moment your calf contracts and pushes blood upward, you exhale slowly and completely, pulling your navel gently toward your spine, drawing your diaphragm upward, which increases thoracic pressure and assists the valve action in your veins. On every lowering phase, the moment your calf releases and draws fresh arterial blood in, you inhale deeply through your nose, letting your belly expand outward rather than letting your chest rise, drawing your diaphragm fully downward, which creates the negative pressure that pulls venous blood upward from your legs into your thoracic cavity. You are now running two pumps simultaneously. The skeletal muscle pump in your calves and the respiratory pump in your chest are working in coordinated, synchronized rhythm, both pulling blood in the same direction. At the same moment, this is not complementary. This is synergistic. The effect is not additive, it is multiplicative because both systems are amplified when they align. Practice the breathing separately before you combine it with the leg movements if you need to. Breathe in through your nose and let your belly rise, not your chest. Place one hand on your belly and one on your chest. Your belly hand should rise. Your chest hand should stay relatively still. That is diaphragmatic breathing. Once it feels natural, add it to your heel raises and you will feel the difference in your legs within the first session. Many people describe a warmth or a tingling that begins in the feet and moves upward. That is real. That is blood reaching tissue that was oxygen deprived moments ago. I want to talk about nitric oxide now, because this is where the 7-day timeline stops being a marketing claim and becomes a precise biological prediction. Nitric oxide is a gas, a signaling molecule produced by the endothelial cells that form the innermost lining of your blood vessels. It is the body's primary vasodilator. When endothelial cells release nitric oxide into the surrounding smooth muscle tissue of the arterial wall, that muscle relaxes. The artery widens, resistance to blood flow decreases, more blood reaches more tissue. In young, healthy adults, this process is continuously calibrated by something called shear stress, the mechanical friction that moving blood exerts against the vessel wall. Higher blood flow means more shear stress, which triggers more nitric oxide production, which causes vasodilation, which accommodates the increased flow. It is an elegant feedback loop. In aging blood vessels, this loop begins to break down at 2 points. First, endothelial nitric oxide synthase, ENOS, the enzyme responsible for producing nitric oxide, becomes less active with age, partly due to oxidative stress and partly due to epigenetic changes in the ENOS gene's expression. Second, an enzyme called arginase increases its activity in aging endothelium. Arginase competes with ENOS for L-arginine, the amino acid that is the raw material for nitric oxide synthesis. More arginase means less L-arginine available, which means less nitric oxide, which means less vasodilation, which means higher vascular resistance, which means your heart has to work harder to push blood through vessels that no longer dilate as readily as they once did. This is a significant contributor to age-related hypertension, and it happens at the cellular level in every person regardless of lifestyle, though lifestyle determines the pace. Now here is the critical connection. When you perform this calf pumping protocol, you are dramatically and repeatedly increasing shear stress on the vessel walls of your lower legs. Blood is moving through those vessels faster, more forcefully, and in a more rhythmic pattern than it has in the last several hours. That mechanical stimulation is a direct and potent signal to endothelial cells to upregulate ENOS activity. The cells respond to being used. A 2021 paper in the Journal of Applied Physiology demonstrated that repeated bouts of lower limb exercise in adults over 65 measurably increased endothelial nitric oxide production within 72 hours of beginning an exercise protocol, and sustained improvement in arterial compliance. The flexibility and responsiveness of arterial walls was detectable at the 7-day mark. The vessel walls are being retrained at a cellular and molecular level to produce more of the molecule that keeps them open, flexible, and responsive. And that retraining takes roughly 7 days to consolidate into a measurable and sustained baseline shift. That is precisely why this video is called 7 days, not because it sounds clean and marketable, because that is when the endothelial adaptation becomes something you could measure on a vascular imaging study. Now let me tell you something about cascade effects that extend beyond your legs, because I want you to understand that this protocol reaches further than most people imagine. Your kidneys filter approximately 180 liters of blood every day. Their ability to do this effectively depends on adequate and consistent blood pressure and flow through the renal arteries. When peripheral circulation improves, when more blood is cycling efficiently through the entire system, rather than pooling in the lower extremities, renal perfusion improves. Better kidney perfusion improves blood pressure regulation, improves filtration of metabolic waste products including urea and creatinine, and supports better production of erythropoietin, the hormone that signals your bone marrow to produce red blood cells. More efficient red blood cell production means better oxygen carrying capacity system-wide, which means better oxygen delivery to every organ, including the one that tends to concern people over 60 more than any other. The brain. Cognitive decline has a vascular component that is consistently underappreciated in public health communication. The brain consumes approximately 20% of your total cardiac output despite representing only 2% of your body weight. It is extraordinarily oxygen hungry, and it is extraordinarily sensitive to even modest reductions in perfusion. Chronic cerebrovascular insufficiency, reduced blood flow to the brain, is directly implicated in the development of vascular dementia and is a contributing factor to the accelerated cognitive decline seen in Alzheimer's disease. A 2020 meta-analysis published in the Journal of Alzheimer's Disease reviewed 14 separate clinical studies and found that interventions that improved peripheral circulation reduced measurable markers of cerebrovascular insufficiency in adults over 65 within 2 to 4 weeks of consistent application. What you are doing for your ankles, you are doing for your mind. Before I give you the complete 7-day plan, I want to address one more variable that determines whether this protocol works at maximum effectiveness or merely works adequately. Hydration. I know you have heard it before, but let me give you the specific mechanism that makes it directly relevant to this exercise, rather than the generic advice you have been given 100 times. Blood viscosity is inversely related to plasma volume. When your plasma volume is reduced, as it is in even mild dehydration, your blood becomes more concentrated, more viscous, and harder to move. It requires more muscular force to push through the venous system and more arterial pressure to push through the capillary beds where oxygen exchange actually occurs. In older adults, this matters acutely because the thirst mechanism, the hypothalamic response that makes you want to drink water, becomes significantly blunted with age. Most people over 60 are chronically and mildly dehydrated without ever feeling particularly thirsty. A 1% reduction in body water increases blood viscosity enough to produce measurable reductions in capillary flow rates in the distal extremities. Your calf pump can only push blood as effectively as the fluid allows it to. Drink 250 milliliters of water, 1 full cup, approximately 20 minutes before each session of this protocol. This is not optional, supplementary advice. It is a functional component of the mechanism. Here is the complete 7-day protocol. I want you to treat this as a precise prescription, not a general guideline. Precision is what produces results. Days 1 and 2. 2 sessions per day, morning session within 30 minutes of waking, afternoon session between 1 and 3 in the afternoon, when vascular tone in older adults naturally dips lowest. Drink your water 20 minutes before each session without fail. Phase 1, 20 heel raises, 2-second hold at peak contraction, 3-second lowering, full synchronized diaphragmatic breathing. Phase 2, 20 dorsiflexion pulls, same tempo, same breathing. Phase 3, 20 ankle circles each direction, each foot. Total session time approximately 7 minutes. Both sessions. Do not accept doing one and calling it enough on days 1 and 2. Days 3 and 4. You are now adding volume. Perform 2 complete rounds of Phase 1 and Phase 2 before finishing with 1 round of Phase 3. So it is 2 sets of heel raises, 2 sets of dorsiflexion pulls, then your ankle circles. Continue with the same tempo and breathing. Total session time increases to approximately 11 minutes. At this point in the protocol, endothelial nitric oxide production has begun its upregulation. You may notice your feet feeling warmer in the hours following your sessions. Some people notice a meaningful reduction in ankle swelling by the end of day 3. These are real physiological responses. Document them. Days 5 and 6. At the beginning of each set of heel raises, add a 30-second isometric hold at peak contraction before proceeding into your 20 repetitions. Raise your heels, reach peak contraction, hold for 30 full seconds while continuing your synchronized breathing, then release and move into your repetitions. This sustained isometric contraction prolongs the shear stress stimulus on the vessel walls beyond what rhythmic repetitions alone can achieve. It is uncomfortable. Your calves will burn. That burning is lactic acid accumulation in the muscle tissue, which is itself a vasodilatory signal. It triggers local release of adenosine and prostaglandins that cause surrounding arterioles to dilate. You are now stimulating vasodilation through multiple simultaneous pathways. The 30-second isometric hold at the start of each set, then your 20 repetitions, then Phase 2 with the same approach, then ankle circles. Day 7. Full protocol, 2 sessions, isometric holds included. Add 1 additional element to your morning session only, 5 minutes of seated marching at the very end. Lift your right knee toward your chest, lower it, lift your left knee, lower it, alternating slowly and deliberately for 5 minutes while maintaining diaphragmatic breathing throughout. Seated marching recruits the femoral veins and the great saphenous vein in the thigh, the large venous structures that drain the entire lower extremity. Adding thigh muscle contractions to your protocol on day 7, when your endothelial adaptation is near its measured consolidation point, sends a whole leg circulatory signal rather than a lower leg signal. You are graduating the system. You are telling your entire lower extremity vascular tree that it needs to be ready to handle increased flow, and your endothelial cells are now biologically primed to respond to exactly that signal. Watch for these specific changes as the week progresses because they are your biological progress markers. In days 1 through 3, watch for warmth spreading into your feet and toes during and immediately after each session. This is local vasodilation occurring in real time. In days 3 through 4, watch for reduced swelling in your ankles when you compare morning and evening photographs. Take them. It is worth documenting. In days 4 through 5, watch for fewer or less severe nighttime leg cramps because adequately perfused calf muscle tissue accumulates less metabolic waste. In days 5 through 6, watch for improved skin color in your lower legs, the grayish or dusky tint that indicates chronic low-level ischemia begins to resolve as capillary perfusion improves. And by day 7, the symptom that most reliably signals endothelial adaptation is this: the numbness and tingling you had come to accept as simply what sitting feels like simply stops occurring in the windows when it previously always appeared. That absence is the sound of vessels staying open that were closing before. Some of you watching this are managing peripheral artery disease or have a history of venous clots or are on anticoagulant medication. I want to speak to you directly. This protocol is low resistance, low impact, and does not involve any movement that significantly elevates systemic blood pressure. The American Heart Association explicitly recommends supervised exercise therapy as the primary first-line treatment for peripheral artery disease, not medication as the first resort, not surgical intervention. Exercise. The exercise described in this video falls well within the parameters of what is recommended. However, if you have had a confirmed deep vein thrombosis within the past 6 months, or if you have an acute clot that is currently being treated, you do not begin this protocol without a direct conversation with your vascular physician. Not because this exercise is dangerous in the abstract, but because an active clot is a specific situation that requires specific clearance. Print this script if you need to. Take it to your appointment. You deserve a physician who engages with evidence-based exercise therapy rather than simply telling you to rest. I want to return to where we started, because I want you to feel the full weight of what this information means. The most dangerous position for your circulatory system after 60 is not exertion. It is stillness. It is the chair you are in right now. And the well-meaning advice to rest more, to take it easy, to not push yourself. Advice given out of genuine concern by people who care about you has been leaving you sitting in a circulatory environment that is quietly, chronically damaging your peripheral vessels, your kidney function, your cognitive blood supply, and your quality of life, without anyone ever giving you the specific, mechanistic tool to counteract it from exactly where you are. You were not given this information at your last checkup, because there is no billing code for a 7-minute seated calf pump protocol. There is no pharmaceutical company funding a clinical trial to prove its cost-effectiveness. There is no procedure to schedule. There is only the biological reality that your venous system was designed to be driven by your muscles. Your muscles need to be used to maintain that function, and the tool to use them is already in your chair. 7 minutes, 7 days, 2 pumps working together, the one in your chest and the one in your calves, synchronized by your breathing, supported by your hydration, and given the time they need to retrain the cells that line your blood vessels from the inside. Your circulation is not a fixed condition. It is a dynamic, responsive, trainable system, and it is waiting for exactly what you are about to give it. Your heels are on the floor. The water is in your hand. Start the clock. Everything changes from this moment.